Good afternoon, everyone, and welcome to the Texas Developmental Screening and Surveillance Echo brought to you by UT Health San Antonio in collaboration with the Texas Department of State Health Services. My name is Maria Gutierrez, and I will be facilitating today's session. As always, we'd like to start off the session with a few housekeeping items, so we'll get started with that. To help us out with attendance, please enter your full name, affiliation, and email into the chat. Thank you so much to everyone that already got started. As a reminder, these sessions are being recorded for later distribution, so you're always welcome to refer back to a previous session by visiting our Echo website. We do ask you to please stay muted unless you're speaking, though we do encourage using the chat, raising your hand feature to really allow a lively discussion today. If at any point during today's session you're having connection issues, please privately chat Karen or UT Echo IT for assistance today. As a reminder, to ensure privacy, no personal health information is allowed at any point during today's session. This does include names, addresses, birthdays, or any other identifiable information. We want to make sure that we make every effort to avoid biases and stigmatizing terms so that we can continue having a space that is respectful and safe to learn with everyone. So with that, we'll go ahead and get started with some team introductions. I see Faith. Would you like to introduce yourself?
Sure. Hello, everyone. Good afternoon. Happy Friday. My name is Faith Rivera, and I am the CEO and Principal Consultant with Alo Civitas Consulting. Thanks so much for joining us today.
Thank you so much, Faith. Dr. Cox.
Happy Friday, everybody. I am Jennifer Cox. I am System Director for Provider Support and Training with My Health, My Resources in Tarrant County, working specifically with Help Me Grow North Texas. Glad you're here.
Thank you so much, Dr. Cox. And Dr. Mandel.
Hi, I'm Dorothy Mandel. I'm an associate professor at UT Health Houston School of Public Health, and excited to have you guys here today.
Thank you so much, Dr. Mandel. And just as a last reminder to everyone, today's session will look a little different as we will not be going into breakout rooms. So throughout today's session, we'll go ahead and just stay together in the one main room. So with that, Dr. Cox, I will go ahead and hand over the mic to you as you will be our didactic presenter for today.
Okay. Like I said, glad that everybody is here. Let me get my screen shared. Okay. Can everybody see that? Does it look? Thank you for the thumbs up, Faith. Okay, so we have had a request from people to talk a little bit about what early childhood special education looks like or may look like for many of the students that you serve that may have disabilities or that may be moving from your program to public school at some point as they're growing and need early childhood special education. So a couple of disclosures. The views and opinions expressed here are my own. They're not official views of UT Health San Antonio, and I have no financial conflicts concerning this presentation. And we always want to be mindful of language and our own bias. We know that sometimes we can be unaware of those. So we value your feedback, encourage you to let us know if we use any language that is offensive or stigmatizing, because we always want to be working to improve that. Okay, so early childhood special education, or ECSE. Some of you may remember a day in which this was referred to as PPCD, or Preschool Program for Children with Disabilities. But about 10 years ago, Texas changed the language to line up more with the national language for the programming. So it is referred to as ECSE, or Early Childhood Special Education. And this is state and federally mandated services for young children with disabilities between the ages of 3 and 5 and who have not started kindergarten yet. So they may have turned 5 during the school year, but they weren't 5 on September 1st to be in kindergarten. Children who meet eligibility, and we'll go through eligibility and what those services can look like over our time together. But the children who are eligible are entitled to a free, appropriate public education. So you may hear me refer to FAPE throughout the presentation, and that's what FAPE is. It's that free, appropriate public education. And all of these requirements fall under the Individuals with Disabilities Education Act. Now, what I've always thought is interesting is your 3-year-old to 21-year-old services are Part B, but Part C, alphabetically, that comes later, age-wise is actually before. So the Individuals with Disabilities Education Act Part C services are the early intervention services, that birth to 3. We've talked about many times throughout our echoes for our young children who may need that developmental support in those early years. But if a child from birth to 3, there is one caveat I just wanted to put in here. As I said, birth to 3 is early childhood intervention. 3 to 21 is usually your public school. But if a birth to 3-year-old is deaf or hard of hearing, or is blind or visually impaired and is eligible for those services, they can actually start receiving services from the school at birth or when those disabilities are identified. And they work in coordination with ECI services, so they'll have the early intervention specialist, any therapist through ECI they need, but then they may also have a deaf education teacher or a teacher for the visually impaired, an audiologist with the school district, different people that start working with them before they turn 3. Okay, this chart, nobody here needs to memorize. At one time, I did have it memorized, however, as a former special ed director, because this is the chart about our students that are receiving services from ECI during that birth to 3 period. This is also why it is so important for our families to get referred to early childhood intervention when there are concerns. And I know we've talked many times about parents' resistance. They're not ready yet. We know that's part of the process. There's no magic button we can flip. But one of the reasons we know it is so important, besides that we get the most benefit from early intervention, is if a child is already enrolled in ECI, there is a federal timeline for how those services transition from early childhood intervention to the local education agency, which is your school district. So there is a point at which ECI notifies the school district that, hey, we've got 5 2-year-olds. They're going to be turning 3 soon. And then they set up meetings with those families to meet with school district staff to talk about what services may look like, what is early childhood special ed. And then when parents give their consent, then all of that process starts. Because the goal is that there's no gap between services. You were getting ECI services, you're approaching your 3rd birthday, now you just transition to school. So that is really the purpose here of this timeline, to show that when our youngest children with disabilities are receiving early childhood intervention, they're most likely to receive that uninterrupted form of instruction and therapy, and they don't have to wait for all of the timelines if the referral is made later. Okay. So a little bit about what is early childhood special education in our schools. As I said, it is for eligible children 3 to 5. The federal requirements state that the services that are provided need to be in the least restrictive setting, and that'll come up a few times through this presentation too. But that means that they are with children their age that do not have disabilities as much as possible, and they're only removed from that setting when it's absolutely necessary. So early childhood special education is not a place, it is a service. So early childhood special education can take place in a pre-kindergarten classroom in a school district. It can take place in a Head Start classroom. And then there are some children who need that smaller specialized classroom, and we'll talk a little bit about that too later. All of these services are free to the family, so that goes back to that free, appropriate public education that is a requirement in IDEA. So who is eligible? There is a two-prong requirement to receive special education services. And one is that the child meets eligibility for one of the disabilities listed in the Individuals with Disability Education Act. And we'll look at all of those categories of disability in a minute. The second piece, though, is that the student must require specially designed instruction in order to access the curriculum, to make progress in the curriculum, and to meet the unique needs of the child. So if we think even ninth graders, just to pick an older random age, there are probably hundreds of ninth graders in schools around us that may actually meet eligibility criteria, maybe for something like ADHD, but their needs have never risen to the level, or it hasn't been determined that they need the level of being taught something differently. Maybe they're on medication, maybe just the way it impacts them. I know at one point, working with the special ed director in a different district than where I was, they had a student who had cerebral palsy, no cognitive needs. So he had physical needs. He was in a wheelchair, but he had no need for specially designed instruction. He was in gen ed classes all the time. So he did meet that eligibility of a student with the disability, but he didn't need adaptations in the content, the method, or the delivery of instruction. So these are the categories of disability in IDEA. And we have autism, deaf-blind, deaf or hard of hearing, emotional disability. This is often things like anxiety, depression that are impacting their learning, their ability to make friendships, relationships at school, your intellectual disabilities. Your multiple disabilities is when a child meets criteria for a variety of different disability categories here, but none of them really give a full picture of that student's needs. So maybe the student is visually impaired, has a traumatic brain injury, and an orthopedic impairment. So just talking about those things individually, you don't really get a full picture of what that student's needs are. And so they may be eligible under that multiple disability category. We have orthopedic impairment, other health impairment. I would say in my experience where I see that used the most is with ADHD, but it can be used with other medical diagnoses that may impact their access to learning in the classroom. Specific learning disabilities, this would be your reading disability, your math disability, speech impairment. As you can imagine, thinking of the children that you serve all week, this is the most common eligibility category for our 3 to 5-year-olds in school, that they're being referred because somebody is concerned about their speech. Then, of course, we have visual impairment. Developmental delay is a new category in the state of Texas. It has been around the country for several years, but this is where the evaluation is complete. The IEP ARD committee believes the student meets eligibility category for one of, or eligibility criteria for one of the disabilities listed here, but they're not quite sure. So they may say that there's a developmental delay in communication, and then by the age of 9, they have to determine, are we going with speech impairment, or intellectual disability or learning disability. It gives them a little more time to decide, but allows that child to still receive the specially designed instruction from special education. And then non-categorical early childhood is no longer assigned to young children right now, but there are some children who may have received it 2 or 3 years ago that haven't quite aged out. So non-categorical early childhood is very much like developmental delay. It was that the evaluation team and the ARD committee would say this child meets eligibility criteria for, let's say, autism. But we want to look at it again by the time they're 5 and determine if we really want to go with an autism eligibility. So for those couple of years, they might have been non-categorical autism or intellectual disability. So these are the areas in which children need to qualify to receive services. And this list too can be difficult. I would often receive calls from parents that would say things like, I want to refer my child because of his behavior at childcare. They're, about to kick him out. And I'm like, okay, so let's talk about, what's the suspected disability? And, I don't know, it's behavior. And parents don't have to know what they might qualify, but we do start that evaluation with a question, kind of like, does this child have autism? Might this child have a developmental delay or a specific learning disability? So often trying to help parents understand that there are children who may need support in school, but that don't meet criteria for one of the specific disabilities in the federal law. And just so anyway, special education does not serve everybody who might need additional help in school. They have to meet eligibility criteria for a disability and have that need for instruction. Any questions so far? I know this can all get pretty technical. So here, and if you go back and after they email out the slides, this is actually a link to this full guide that explains to parents the process. And I think it could be very helpful. It answers a lot of different questions. It talks about what some of those concerns may be. My child's not speaking as much as other children. They don't follow simple instructions. They have trouble interacting with others. I don't understand their speech. These are all reasons, and as you can imagine, there are many more that a parent might request an evaluation. And this form then goes through the process, how they can find what their local school district is. Many times parents, they've been in the birth to 3 world their whole parenting, and they're not sure where their neighborhood school even is or who they might need to call. So that QR link on here provides that. It gives some information about ECI and then goes through that referral process, which we will do as well. So if you are talking with a family, there's concerns about a child's development, they're now too old to be referred to ECI, so you're encouraging the parent to reach out to the school district about an evaluation and to look at what services might be available. The number one recommendation that I would have is to make sure that that request for an evaluation is put in writing to the school district, because that written request starts a timeline, and the timelines are all so important because it takes quite a bit of time for a child to complete the evaluation and have the IEP ARD meeting and start services. So you want that clock to start ticking as soon as possible. I know in my experience, there may even be parents, maybe big sister is already at the elementary school, and mom or dad or grandma's worried about little brother that's almost 3. And in the carpool line, that caregiver will say, "Hey, I really wish that, Billy would be tested for speech." And whoever helped put the big sister in the car is like, "Oh, yeah, that's a good idea." And the parent leaves thinking there's been a formal request for an evaluation. That adult who helped put the big child in the car puts 10 more kids in the car before they go back into the building. They've talked to 20 parents, and things just don't flow like they should. And you could even have a conversation with that teacher, and she's like, "Oh, I thought she was just chatting with me. I didn't know she was formally requesting it," or just all of that. So the clearest thing that can be done is that in writing, it can be an email. Um, if you know school staff, you can send it to the special education director that you can find on the website. But anyway, that it is in writing, um, and that you're stating the name of the child and what your concerns are. And as I mentioned, the timeline, what happens at that point is once the request is received in writing, the school district only has 15 days to respond. And there's 2 ways that they can respond. One of them's not likely, though. Um, the first one that they're most likely to do is call you in by that 15th day, the parent in, discuss the evaluation concerns, discuss what evaluation would look like, and get the guardian's written consent for evaluation. There is the other option, as I mentioned. The school district can decline to do an evaluation, and they have to provide a written reason why they're not doing that. But in my experience, when they don't know the child, they're going to want to meet this timeline and take a look and see if the child might need services. There have been times when I have seen that option used has maybe been the child's been evaluated 3 times, and somebody still thinks there's a disability not identified, and it's been tested over and over. And so the district might write a letter saying, "We've already looked at that. We're not going to evaluate again." And then there's options about that too. We'll get to in a little bit because, like I said, everything in special ed truly is, it depends. There is no nice little flow sheet that if this, then this, because there's always, "Oh, tell me more about that before I give you an answer." Because it is about individualized services. So there's no quick, straight answer. Dr. Mandel, I
Yeah,
see you came
Jennifer.
off mute.
Yes, definitely. There's a question specifically related to this is what happens when the school district runs out of time? And I'm happy to talk about what happened in my school district when
Yeah.
clock ran out. But if you want to talk about what happens when the school runs out of time from a general perspective.
Yeah, from a general perspective, what the district is supposed to do is, finish it as soon as possible so they can have the art meeting. Um, and then at that meeting, there should be a discussion about whether compensatory services or makeup services are needed. So maybe we should have already met and determined you needed speech 30 days ago. And so you could say you've missed, say you're recommended to get speech twice a week. We could say you've missed 8 sessions because we were too slow. And so we need to come up with a way to make some of that up. Dr. Mandel.
So I would also say from that parent perspective, when the district, just because the district ran out of time doesn't mean that the district has their idea requirements have gone away. They still have a obligation to do an evaluation, even if that evaluation's late, they just get dinged on it federally. So my daughter was in a district that was super behind. It made the news about how far behind they were on evaluations, and we had to wait a year. They were that late on getting evaluations through. the process does not start over. What we did was just keep contacting the school to have the school keep contacting the district to move them up and move them up and to understand when the evaluation would finally get done. So it doesn't, they can't just run the clock out and then it goes away. The clock runs out and then now they're on the hook federally because they're violating a federal provision.
No, absolutely. And all of that is reported. I mean, we did regular timeline reports of, did we have any that were past the 15 days for consent? Did we have any that were past the 45 days for evaluation? And it does impact funding. Not to make excuses by any means, but I do know some evaluations are delayed because districts struggle with staffing, and particularly post-COVID, speech therapists, educational diagnosticians. There are often many vacant positions in districts. And then whenever I would even try to hire people with agencies like contract speech therapists or OTs or PTs to fill in, the agencies would have nobody to send because everybody's looking for speech therapists, OTs, and PTs. So it is not right. It's not legal. It doesn't meet the needs of the child and the family. But sometimes that is what's going on. Okay, so we have the 15-day timeline to respond to the request. They have the parents' consent for evaluation. Now they have 45 days to do the testing and write the report. And there are timeline exemptions when it comes to holidays and summer break. So if school receives consent at least 35, but less than 45 days before the last instructional day of the school year, the written evaluation must be done by June 30th. So there must be some staff to do those that kind of fall over the gap to complete those at the beginning of summer. As we mentioned here, this is 45 school days. So if you request an evaluation, 45 school days can go out really long, especially if you're talking about around Thanksgiving, Christmas, spring break. All of those days don't get counted in that 45 days. And so that's why the earlier we refer, the better. So now the report is complete. Hopefully it is done before that 45th day. But now another timeline starts. So again, we've got another month to wait before the IEP ARD meeting has to take place. So this meeting must take place within 30 calendar days of the completion of the initial evaluation report. So you can also see how crazy all this is for school district staff too, that they're tracking all these timelines. And this one's calendar days, this one's school days, this one is around a holiday, this one's not, that mistakes and errors certainly do happen. But that you may be familiar, many places in the country refer to these meetings as IEP meetings. And it stands for Individual Education Program Meeting. When you plan an IEP, you meet for an admission, review, or dismissal. So we're either meeting to see if the child is going to be admitted to special ed, we're reviewing their progress, or they've made great progress and we're dismissing them. But in Texas, we tend to call them ARD meetings. But you hear both IEP, ARD. And so I tried, you can tell where I have taken language from TEA documents because it all says ARD. And if I write it, I'll usually write it IEP, ARD. But that meeting has to take place within 30 days of the report. And in that meeting, the committee determines if the child is eligible for special education services. So do they meet eligibility criteria for one of those 14 categories? And do they have a need for special education and related services? And the people who must be included in that meeting are the parent or guardian, a general education teacher, a special education teacher, a school district representative. Often that's an assistant principal or a principal at a school, but it can vary. It is someone there who represents the district. And then someone who can explain evaluation results. So in Texas, often that's an educational diagnostician. It can also be a licensed school specialist in psychology, can be a speech therapist, but someone who can talk about those results with the family. And then this is the purpose of an ARD meeting. So as I already mentioned, it's to determine if a student is eligible for services. So again, they're always looking at those two questions. Do they meet the criteria for one of the categories of disability, and do they need specially designed instruction? We talk about what skills the child has right now, and what kind of progress have they been making? What are their strengths? So really looking at both academic and functional skills. They're able to request what they want or need, or they use pointing. They use speech to let us know what they want or need. They're able to get around the classroom independently by walking or the other means. They need visual supports, whatever that child has been demonstrating. And often that's where you, as an early childhood provider, may also be able to provide input. Often the evaluation staff will reach out to those that the parents have given permission for the school to contact to get input about what the child does on a typical day. Because again, we all know what a child does with a stranger at the red table in the corner of that one room with those specific toys on the table may look very different than what a child may do with you, that he or she knows, spends hours with a week, and that you already have a routine. The parent is also able to bring anybody to an ARD meeting that they would like. And so I've certainly seen them bring early childhood teachers with them, ECI staff with them, a private therapist with them, anybody, their mother, grandma, whoever will help them feel more comfortable in that meeting. So if the child is eligible, and we've gone through these pieces, then the committee talks about what are the goals that we want the child to reach over this next year. And that's where the pre-K guidelines really come in, because those are the learning standards for our 3 to 5-year-olds. And the goal of the special education services is for a child to have access and to make progress in that general education curriculum. It may look very different because of adaptations and modifications we make to the curriculum based on their needs, but we would look at the pre-K guidelines and determine which ones, based off of the student's needs, do we really need to focus on, and how do we focus on the things that are barriers to them making progress. So I know for us, sometimes maybe one of the pre-K guidelines has to do with rote counting, but a child is unable to rote count, and it's really their speech that's interfering with that. And so the goal may be that with speech therapy and with visual supports, the student will, identify the numbers 1 to 10, which is different than rote counting. But that would be a way that we would change it until they have the speech to be able to actually call all of them out in order. We're fortunate with pre-K guidelines address social emotional skills. There is no other grade level in the state of Texas where there are social emotional standards. But for our 3 to 5-year-olds, we're able to write goals around those pre-K guidelines and the skills that they need. Some may be attention, being able to sit with the group, but we know that by the end of the 4-year-old year, we want children to be able to participate in an active community building group time for 20 minutes. For some of our kids, it may be we would like them with objects to hold related to the story being read to stay with the group for 10 minutes. Because again, we're adjusting to meet their need and then slowly building on that as their skills develop so that they are able to participate. And then we do those kinds of things through accommodations and modifications. And these two can be tricky, but the difference in them is accommodations does not change what the child is learning. It changes how they are learning. It changes how I'm teaching what they're learning. And it may change things in the environment or materials. Maybe turning pages in a book is a skill that I want you to have, but because of fine motor needs, you're unable to. But if I can provide the accommodation of taping popsicle sticks to each page, now you're able to take a popsicle stick and turn it over, and I've given you an accommodation to turn the pages in a book. Accommodations can also be things, many of us, I don't have mine on right now, but wear glasses. It doesn't change my work. It doesn't change what I'm doing, but I may be wearing something that someone else doesn't wear. That's not written into an IEP, but that's an example of an accommodation many of us may have. It can be larger print, time, schedules changed. But your modifications are where we actually change the content that is being taught, because you're just not at this skill level yet. And we know maybe that there's these 4 skills prior to this one that we need to be working on to build you up so that you can then master the pre-K guideline. And so I may write goals that change your content so that it's at the level where you are, but again, building up to the pre-K guideline as appropriate. Then after we've talked about what your goals are, how we're going to teach those things to you, then the committee talks about, now where's the best place to provide these services? And as I mentioned earlier, we want to do that in the least restrictive environment so that they're removed from settings with non-disabled peers as little as possible and only when absolutely necessary. So the IEP meeting, we could be sitting talking about that and say, you know what, the goals that we want Jennifer to work on and the accommodations that we're going to provide for her, those can all be done in a pre-kindergarten class. So she's going to stay in her pre-kindergarten room and receive these specially designed instruction services. We could also go through this and know that Jennifer is easily overwhelmed by lots of noise and lots of movement, sensory stimuli, that she's able to focus and stay with the task longer when it's quieter, maybe even when the lights are down a little bit lower. So maybe Jennifer is in the pre-K kindergarten room 3/4 of the time, but when we are working on her speech and communication skills, we're going to do that in a room that is separate because it's quieter, calmer, and we can meet those sensory needs in that time. I know I personally, though, have also seen students at this age that truly, maybe for medical reasons different, that their least restrictive setting really is a separate classroom with maybe 4 or 5 students, and that is where their needs can be met. So least restrictive environment is different for everyone. It is not always the pre-K setting. For some people, it is a specialized classroom. And then the ARD committee talks about related services. And I have listed those right on the next one. We'll go back. These are things like occupational therapy, physical therapy, audiological services, parent training is a related services. Related services are things that cannot stand alone. Um, because related services help support the goals, the accommodations, and the modifications that are taking place in the instruction. So, instructional services, as we mentioned, pre-kindergarten classroom might be that specialized self-contained classroom. In the state of Texas, speech can be a standalone service, so it is considered instructional. Specialized instruction from teachers of the deaf or hard of hearing or visually impaired can also be the instruction being provided. But a student who is qualified for special education must be receiving some kind of instructional service. And these are examples of those. Here's another statement again about those instructional services must take place in the least restrictive environment. Your child must be educated with children who do not have disabilities to the maximum extent possible. And then here's the examples of related services. So again, these cannot stand on their own because they are things that are supporting the specially designed instruction. The student may have handwriting goals because writing is part of pre-K and kindergarten, especially kindergarten and first grade. And so the OT may be helping support that. School health services. I remember having a parent calling me one time that the child was 3 and had type 1 diabetes. And because the child would need health services, she was calling about early childhood special ed. So then, when we had the conversation about, well, what disability do you think he needs? What specially designed instruction? Like when we evaluate, what are we looking for? And her response would be, well, he's going to need to be taught how to take care of himself because of his type 1 diabetes. Like, absolutely. But that wouldn't have been an instructional goal because that's not tied to the pre-K guidelines or if he was older, the TEKS. So again, going back to that, you have to have one of those categories of disability and need specially designed instruction to access the curriculum. And that can be really hard, and especially with these related services and also speech that is instructional for us in Texas. This is where the difference between medical model and educational model can come in. And so often, those of us who care about kids, when we're trying to get them supports, we want to get them everything they could benefit from. What can be really hard with school services, again, everything's guided by the Individuals with Disabilities Education Act, that it is based again on having access and making progress in the general ed curriculum. So, the young man I mentioned earlier with cerebral palsy that was in the wheelchair, that used a wheelchair, he didn't have any trouble academically. All of his grades were above passing. He had great social relationships. Yes, he has an orthopedic impairment. He'd even probably meet criteria for other health impairments because of the cerebral palsy. But specifically for him, any of these services would not have been addressing things in the classroom, having access in the classroom, or making progress in the curriculum. Another thing that can be really hard too And it's in that word appropriate with faith, free, appropriate public education, is that the law is written so that the standard is the child is making reasonable progress
Mhm.
based on their individual needs and diagnosis. So we would all love for all children um, to excel and trying to think of how to say but special education is there to support a child and again like I said give them access. It's not about repairing anything. So my mother's recently had a knee replacement. She went to extensive physical therapy so she could get the most out of that new knee for her. But even when she left this surgery center, she was walking with support. She could have gotten around a building on her own. So that's very much the medical model. They're trying to help with those skills for functioning, but they're not looking at the learning piece. And would she have had access if she was sitting in meetings or in classrooms? She would have been fine.
Yeah.
So I know Dr. Mandel, you had wanted to say something about medical model and
Yeah. When my daughter transitioned into educational services, this was a huge mind shift for us. And I'm a developmental psychologist. I actually study this stuff, and this was hard for me. So it was really hard to sit with in this ARD meeting, knowing what kind of occupational therapy she needs to actually exist in the world. And then telling me they're giving her 30 minutes once a month for occupational therapy just to help with writing. And that's something you guys should help prepare your families for if they start in educational services. Those educational services are there specifically around the TEKS and around the preschool educational goals. And if what they need can't be tied to one of them, they're not going to get it. Um, I mean, we fought a lot to get her more OT. A lot of families hit this when they come from ECI into early childhood education, that you lose occupational therapy because the school is not providing occupational therapy, so your child's not going to be clumsy or be able to navigate or be able to have good sensory activity. They're there to make sure that the child has enough OT to write. And so that is a huge difference between early childhood intervention and school-based services. And also one of the reasons why, if you're concerned early, get them into ECI, as opposed to the school-based services they're not there to, Dr. Cox, I'm going to use this term, optimize development. They're there to optimize education.
yes.
And, but as a parent, you want your child's development optimized. So it is a conflict. It's a huge conflict. And like I said, even me, who's in this position, who had a child who went through this, it was hard to sit there and say, what do you mean she doesn't need OT? The girl like runs into the wall all the time. My daughter's clumsy. She needed OT. She just recently got dismissed out of speech therapy. Anybody who talks to her will hear that she has a speech impediment, but it is not enough to interfere with her education anymore, which is great. We should celebrate that. But recognizing they're not there to optimize her speech, they're there to get her speech enough so that she's going to communicate very well in an educational setting. So this is part of our reason of like identify and get in. Concerns should be identified in early, before the age of 3, so that we can get them into ECI services that are more centered around optimizing development, as opposed to early educational services that are centered on optimizing educational achievement.
Well said. Thank you. I like that optimizing development. because that's where I was trying to figure out what to say. And, I'm glad you brought up the speech example too, because we would have parents come to us too that they had seen a private therapist. Um, they were going private pay, so not insurance. Um, and, the child may be 4 and they're going to work on their R's. Well, when a school speech therapist does an evaluation, the R sound isn't considered delayed until many years later. So a private therapist can do anything someone's willing to pay for therapy wise. But school can only intervene when they meet that eligibility criteria and it's impacting their learning and progress and access.
And so that on the speech side then leads to a situation of a diagnosis of a receptive disorder, a receptive language delay, an expressive language delay. So they don't have enough words, they don't understand enough words, or they don't speak enough words. Those two really become central to the school diagnosing and providing speech therapy. So my daughter no longer has either one of those. She doesn't have an expressive delay anymore. But part of that is like they're gonna work on the R's and they're gonna work on the THs because it helps her on phonics. We were able to tie it to a phonics based we were able to tie it to a phonics based learning goal. But now she's maxing out receptive and expressive language. Yay! But she still can't pronounce a TH. So, but the school's like, that's okay. A stutter will also get them speech therapy as well. But recognizing the bar of what interferes with education is not the same as the bar for what interferes with what is not considered optimal development.
No, thank you. And yes, they do address it is that link between literacy is huge. But again, sometimes it's the age that, they'll say it's okay that a 3-year-old can't say their R's. That's developmentally appropriate, but no, parents don't usually want to wait because they see like, hey, but we can do something now. And so that can be really hard. And then I think this right here is probably a good place to stop because this is an option only parents of 3 and 4-year-olds have. And it is in the law referred to as dual enrollment, which means if you have a child, let's say in your program, and the parents refer to the school district, they do the evaluation, the child is eligible for services, the family does not have to take advantage of everything the school district offers. They have the right to say, I want to keep my child in the program they already are. Thank you for offering 4 hours a day, 5 days a week, but I want to bring them only for speech. Or I'd like them to stay in their other program 3 days a week and come here 2 days a week so they can see the OT and PT on the days they're here. Just a little caveat, this is something sometimes even in a district where I would struggle with other people in the district. Because if a family chooses this option, and it is their right to choose the option. Please hear that over and over. This is their right. They only have it when the child's 3 or 4, but the school district does not get any money for them. So they may not talk a lot about this. We would, but then I would even get calls from our student services office like, why is this child only coming 2 days a week? And honestly, I'd be like, because that's what the parents wanted. They weren't going to come at all. So we want them to get early intervention before they show up for kindergarten. So this is the right of a parent. In this process, the IEP ARD committee develops the full plan. This is what we're offering the child 5 days a week in a classroom, OT, speech, whatever's required. And then the parent says, I'd like dual enrollment. And then the committee goes through and picks what they believe would be most supportive of the child's progress. And that becomes the child's plan for until the year they turn 5 or go to kindergarten. So I know that is a lot of information, but it's almost 2.
I have a question.
Yes.
Okay. Um, Kind of confused with the dual enrollment. I have a 3-year-old, and
Mhm.
so he attends my center. But since you say dual enrollment, it would be great if his mom can enroll him in the local elementary school to see if they could provide speech. He does have a diagnosis of being on the spectrum. Uh, Before he turned 3, we were trying to get ECI out. He had different therapists that was supposed to come, and whomever was coming, they were saying that they would come. And so I would ask mom, I said, um, when is his therapist coming? And she said, she's been coming, and you have to sign in. And I take a copy of your badge and put the time, you come and time you check out in the child's file. But they have been saying that they were coming, but they were not coming.
Mm.
And so then he turned 3, so it's no service. And so, I mean, now he's beginning to talk, uh, but he would really benefit from dual enrollment. I mean, we can only do so much, but that will prepare him. But I don't know if they would take him. So it's good to know that they can do the dual.
Right. And the dual enrollment piece would happen after the evaluation. So the
Okay.
first step would be for the parent or guardian to reach out to the school district in writing, tell them, I have a 3-year-old son, this is his name, and I'm concerned about their speech. I'm requesting a full individual evaluation. And then they'll evaluate, and if he qualifies, develop a plan. And then at that point, the parent or guardian can say, okay, I love the whole plan, or I want just these pieces of the plan because I want him to stay in the program where he is also. So it would start with evaluation.
Okay, I have a question. Do you have, because I went somewhere before, first 3 years, and I can't find the folder, but they have like a template of a letter because, it's if parents don't know the lingo or whatever for the school, it kind of get pushed back. So do you guys have like a template of a letter that a parent can use to
That's a
send to the school?
That's a great question. Maria and Karen, I can get you a template that could that go out when the follow-up email after the session goes out?
Of course, we can share that with
Okay,
everyone.
Thank
perfect.
you.
You're welcome.
I want to say too, this dual enrollment thing is something that you don't hear often when your when your child is transitioning. And we actually didn't go early childhood education route when my daughter came out of ECI because dual enrollment was not explained to us, and we did not want to take her out of the child care center that she was in. So now that now I know what I know, I would sing from the rooftops about dual enrollment, because it can be quite a changer, and it can make a difference for the parent of like, but I have stability here, and especially for a child with autism, that's so huge. And keeping that stability, but still getting them services.
Absolutely. And that community they may have already developed where they are, that sense of belonging. Any other questions?
If there's no other questions, oh, go ahead, Dr.
I
Mendel.
just want to leave one thing. As a parent who's gone through this, not as a professor or anything like that, but as a parent who's gone through this, the one thing I wish our child care center had done when we moved my daughter to private therapy is I wish they had pushed us to start the educational evaluation before she got into kindergarten. And so I'm talking January, whereas they didn't bring it up to us until the summertime. And then we got caught and everything, and it took her a year to get services. So start, if you know you have a child who's receiving private therapy, or you know they have a diagnosis, but you guys are handling it really well within the center, start that conversation at least 6 months before you know they're going to go into kindergarten, because this is a long process. And especially because you're counting by calendar days, and then you're counting by school days, because then that way the request goes in during school, not in the summertime.
I'm so glad you brought that up. I know we had talked about the importance of that. Because I would, as a special ed director, the last 2 days of the school year, get a call from a parent. My child's starting kindergarten next year. I want them tested before school. Or the week before school would start. My child starts kindergarten next week, and he gets this private therapy, and I think he's going to need special ed services. And, if the evaluation doesn't start till September, it's December before you've gone through all those timelines, and the school year is almost halfway over.
That's why I try to encourage my parents when they are 3 to start them, because I had a parent, I said, why didn't you put your child in last year? So she put her child in 4, and the child had a diagnosis, but then she was upset with the school because she wanted them, they put her in a regular class because they didn't have any documentation. And it was after Christmas before they really got the ball rolling. But by this time, mom living situation was unstable, so I don't know if she continued at that school. So that's why with this child, I want to help them out. Let's get things lined up right now so that, as he progress, they'll have all that documentation, because parents, they don't know, and then they expect for the school to just make it happen like all of a sudden. And it's a process trying to get them tested and getting them on the calendar. So that's why I try to get them to go in at 3 if they possibly can.
Thank you so much, everyone. And thank you, Dr. Cox, for such an amazing presentation, Dr. Mendel, for your support. Thank you, everyone that is still with us, 6 minutes past the hour, but we're going to quickly go through announcements so you guys don't miss any information. Karen, whenever you're ready. So unfortunately, TechPeds is not available at this moment. However, once it does become available, we'll make sure to send that information to everyone via email. So please expect a link and a QR code. Karen has also posted the instructions to create a TechPeds account, which is needed in order to claim those credits. So please be on the lookout for an email coming out later today or Monday. Next slide. We do invite you all to come back on August 14th for next not TechPeds, for next Dishes Echo. This session will look a little bit different, as we will be using the space to get some feedback from you all on how to best improve the sessions. So we do look forward to hearing from everyone. We want to be able to hear your thoughts and insights and anything else that you might feel is needed for us to know in order to continue a successful Echo program. Next slide. Lastly, join us on Friday, September 11th for a presentation on executive function and emotional regulation presented by Dr. Mendel. With that, we thank you again for staying with us, and please be on the lookout for that email in order to claim TechPeds credits. Thank you, everyone.